Hello there, my name is Malquisa Royal. I chose to do my middle adulthood presentation on the condition sarcopenia. So let's get into it. I wanted to start off by giving a little bit of history and background on the origin of the phrase sarcopenia, which comes from the Greek words sarco, which means flesh or muscle, and penia, which means loss, which was first used by Erwin Rosenberg back in 1989 to refer to the loss of muscular mass, which later he emphasized the need for research to establish whether sarcopenia is a disease, a normal aspect of aging, or an age-related loss of muscle mass and function. So what is sarcopenia? Sarcopenia is a musculoskeletal disorder defined by a progressive loss of muscular mass and strength, which is usually brought on by aging naturally. Sarcopenia impacts the elderly population, reducing daily task, independence, and long-term care needs. It is a chronic disease that predominantly affects individuals aged 60 and older, which those rates increase with age and gender, though studies on affected ethnicities are inconsistent. So the process of muscle loss starts in our 30s or 40s with noticeable acceleration in the muscle loss around age 60. So around that age, more falls, fractures, frailty occur, which raises the risk of hospitalization, surgery, and other complications, including death. So if we look over to the image that I have here, the progressive and accelerated loss of muscle mass and strength is due to aging, and it affects about 1 in 14 individuals who are aged below 60, and about 1 in 3 in individuals who are 60 and above. So again, it does affect those just that are older due to natural aging. So the symptoms, depending on how severe the problem is, sarcopenia symptoms might vary, but it is important to remember that these symptoms can also occur in other conditions. So they may include muscle weakness, like having trouble with everyday task like lifting things, getting out of chairs, or climbing stairs, reduced endurance, experiencing fatigue and exhaustion more frequently, a loss of balance, just having that higher chance of falling, having a slower walking speed, having difficulty keeping up with a regular pace, a reduce in muscle mass, that being the muscles, especially in the arms and legs, become visibly smaller, difficulty carrying out everyday life activities like cooking, bathing, and dressing becomes a problem. Fractures may also occur as a result of the weakening muscles and higher, it increases the chance of falls. Weight loss is also a symptom of sarcopenia, but it's an unintentional weight loss. What causes this disorder? So again, despite the fact that aging is typically the primary cause, scientists have identified additional potential risk factors for sarcopenia. Knowing these can, of course, assist in recognizing and controlling the risk related to the illness. So they can consist of being physically inactive, obesity, chronic diseases like chronic obstructive pulmonary disease, COPD, kidney disease, diabetes, cancer, HIV, rheumatoid arthritis, having an insulin resistance, reduction in hormone levels can be a cause, being malnutrition, or just having an inadequate protein intake. A cause can also be a decrease in your ability to convert protein to energy, and another cause could be the decline in the number of nerve cells that send messages to the brain, to the muscles telling them to move. So sarcopenia is a form of weakness in the muscles that is mostly brought on by aging. So again, it'll cause weakness, exhaustion, trouble doing daily activities. Scientists believe that being physically inactive and eating unhealthy diets can contribute to this disease. So individuals with a high BMI can also lead to sarcopenic obesity, increasing the risk of complications compared to just obesity alone. According to clevelandclinic.org, sarcopenia rates vary from 5% to 13% in individuals 60 and older, increasing to about 11% to 50% in those 80 and older. Diagnosis. How do we diagnose this condition? So there is no single test that can diagnose sarcopenia. A healthcare provider may recommend several tests to diagnose and determine the severity of the sarcopenia, but it is diagnosed by assessing both the muscle mass and function, also using a combination of physical tests, questionnaires, and imaging techniques like DECA or CT scans. So we'll dive into a few of those recommended tests to talk a little bit more about them. So you have the physical exam, which the doctor will assess muscle strength, physical performance, and overall function through various tests. They'll also conduct a muscle strength test. A lot of you may have done like a hand grip test where you grab like the doctor's two index fingers, squeezing them, which indicates overall muscle strength. A chair stand test, so measuring the leg muscles by assessing how many times you can stand and sit from a chair in 30 seconds, and a walking speed test, which measures how quickly you can walk a short distance at your usual pace. Imaging tests are also conducted, which again is that DECA, which is used to measure the bone density and can also assess in muscle and fat mass. And then you have the CT scans and the MRIs, which can be used to assess muscle mass and quality. The prognosis. So the disease can greatly affect your quality of life. You may be able to reverse the effects on the condition with lifestyle changes, but if you don't make the recommended changes, the disease will continue to weaken your muscles, and over time you may need full-time care to live your life. No one wants that. So according to the National Institutes of Health, age, multiple medical conditions, falls, fractures, all have a significant impact on the prognosis of sarcopenia. Additionally, compared to individuals without sarcopenia, those with who have surgery have fewer favorable results, like having a higher chance of fractures, having a longer length of stay in the hospital, a higher chance of falls, surgical complications, increased morbidity, and death. So although there is substantial evidence that sarcopenia predicts a bad outcome for a variety of disorders and surgeries, the prognosis of sarcopenia alone is unclear and unstudied. Treatment. How do we treat and reverse this condition? So researchers are currently studying the possibility of using hormone supplements to increase muscle mass, but there aren't currently any FDA approved medications to treat sarcopenia. So again, although there aren't any single treatments known to 100% be effective in preventing sarcopenia, a number of treatments are being used in practice, most which combine nutritional and exercise therapy. So patients' variables like age, disease severity, inflammatory levels, influence the choice of possible therapy options. So for each patient, a customized plan must be developed. Physical activity and nutritional status are critical for healthy aging with lifestyle modifications like stretching, coordination, resistance training, improving muscle strength, flexibility, and balance. But exercise programs and nutritional support effectively treat sarcopenia. But not all elderly patients can do this, so they often struggle. Potential treatments include myosin inhibitors, steroids, growth hormones, and ACE, but have variable effectiveness and side effects. Prevention. So since sarcopenia occurs naturally as people age, it may not be entirely preventable. However, there are things that a person can do to delay the disease growth, and these consist of just improve your quality of life. As I mentioned, just improving that quality of life can greatly enhance treating sarcopenia. So just engaging in daily activities and hobbies without restrictions can retain your muscle mass and your strength. It can also help with self-confidence and independence, which result from a favorable effect on mental health. Prevention of chronic disease. So maintaining muscle mass and strength can reduce the risk of chronic diseases like diabetes and cardiovascular diseases, leading to a healthier and longer life. Improving your nutritional status. I don't have to say much about this, but taking your vitamins and eating healthy could definitely enhance and improve just your general health and well-being. And just the last but not the least, increasing your social interactions. Engaging in sarcopenia-related activities can result in more social engagement, which can help fight like loneliness and isolation, which are more prevalent in older adults. So again, guys, it's very important that we stay on top of just taking care of our overall health and wanting to have a better quality of life. A lot of us are also young, and we think that, we can keep living the life that we live, eating how we eat, and it wouldn't affect us in the future, and that is not the case. So just changing things like eating habits or exercising could really have an impact on your future, and just having those health conditions in the future. So again, I appreciate you for listening and watching my presentation. I hope that it helped in some way, because it definitely gave me a different outlook in life and wanting to do better for myself. I have kids that I want to live longer for, and I just want a better quality of life overall. I don't want anyone taking care of me at an old age. And so again, that's my presentation on sarcopenia. Hope you enjoyed it. Thank you.